you can't overstate the thankfulness you feel. I was diagnosed with acute myeloid leukemia in 2021. I was shocked because I had just finally thought that my first bout of cancer, breast cancer, was done, and I was clear and everything was going to be great from there. So it was quite a bit to try to take in and get my head around that we're going to do this again, and do I have the energy and the strength to go through this one more time. They explained about the AML, or acute myeloid leukemia, and the process that it would be, and that most likely a stem cell transplant from a donor would be required. So I have 5 siblings, and unfortunately none of them were a match for me. I have 3 daughters, and my youngest daughter was a good half match for me. So now it becomes to the public, the very generous people that are willing to go and get tested when they're young enough to find out if they can be a donor, and wait to see if there's someone out there that matches me. One very lovely lady at 28, that's all I know about this young woman, was very kind to take her time, and it's not an easy process for a stem cell donor as well. They have to go through a bit to give me life so that I can keep going, and I'm forever grateful for that experience and for that person.
I was Sharon's stem cell transplant coordinator, so I helped find her donor, and so she was a patient here at our hospital, and we had her registered through Canadian Blood Services, which helps us to find donors internationally and nationally. It's satisfying when you find a good donor, and it's really satisfying when patients get to that point that they get their transplant and they get that new chance at hope for life beyond their cancer diagnosis.
Here in Hamilton, we perform all 3 types of cellular therapy procedures: allogeneic stem cell transplant, autologous, and CAR T-cell therapy, putting us really at the forefront of innovation for treatment for these cancers. And it's really exciting to be able to offer these procedures here in Hamilton, in the region.
I'm thankful to know that there are places like Juravinski Hospital and the Cancer Center out there that can treat people with these specialty cancers. I'm grateful for the nurses, the teams that looked after me, the outpatient nurses. When I'm there, it's a great center.
Being able to be a part and watch her day to day as she recovered through her treatments was truly inspiring. Now that I get to see her, and when she's doing very well over a year out from her procedure, it gives me a smile every day to see how wonderful she's doing, and how motivated she's to continue to be healthy throughout the rest of her life.
Transplants come a long way since I've started, and it's come a long way over the years. It's pretty special to see how much we're able to provide and offer people to have a cure that they otherwise wouldn't have had.
I feel good. I get tired, but I'm able to, golf once a week. I'm able to get out and do my gardening and, spend time with my family and do stuff like that. So, yeah, it's pretty good. Life's pretty good.